Winters, that time of the year when viral infections kick in, skin dries out, and often aches and pains worsen. But winter health is not just about taking care of these problems, also, it is about taking care of your heart health. Cardiac events tend to surge in winters, is what experts say.
In winter, in response to cold, the blood vessels of our of body, they constrict, which is called as vasoconstriction, and that is a mechanism to reduce loss of heat. What it in turn does is that it increases the blood pressure of our body or causes hypertension, and which means that the heart has to work harder.
And these are the symptoms of a heart attack in winters.
Classical symptom is chest pain or angina, but do not attribute it to something else, because it may happen in other parts of the body, like it may happen in jaw, it may happen in right, left shoulder, even right side, and in the back. So any kind of pain or abnormal sensation in the upper part should trigger a warning. Apart from that, other associated symptoms like sweating, uh, feeling of anxiety, all these things, palpitation, a feeling of giddiness, all these associated factors are there.
Also, the way you get up from bed in the morning matters.
Whenever we rise from a sitting position or lying down position, what happens is that the blood from our body goes in lower extremities. So there is a sudden pooling of blood. This is a normal mechanism, but in certain people, even a small change like this, where the blood goes towards the lower extremity, may trigger something like a syncopal episode or fainting spell. This effect is actually experienced by people who are hypertensive and on certain medications. This effect is more pronounced, but this is basically postural hypotension.
Winter months also a time when strokes become common. A stroke happens when there is sudden loss of brain cells.
When we hit the harsh cold weather, our blood is not able to flow freely the way it happens during summer season, right? And because of vasoconstriction, the blood flow gets constricted. The vessels inside our system get constricted.
Experts say hypertension should be managed at all costs to avoid a brain stroke, the risk of which is higher in winters.
You have to keep your blood pressure under control. If you are a hypertensive patient, you need to keep your blood pressure under check, and if possible, keep on taking the blood pressure records in your daily diary. Keep the saturated levels of fat low in your blood also.